Hey, Dave O'Sullivan here, and I'm helping private practice therapists have the confidence to help any patient who walks through your door using our simple ProSport step-by-step system for the month of July, okay? So that you can truly enjoy a fully booked diary of happy progressing patients and ultimately become that go-to physio in your town. Now, in every single episode that I'm doing this month, I promise that I will deliver one thing that you can implement straight away into your clinical practice that's going to help you, your patients, and ultimately give you an edge over the competition. Okay, so today what I want to talk about is the one question that's going to change and help your focus in the objective assessment to ultimately get long-lasting results for even your most complex patients. Okay, so this question, it's helped over 850 therapists really dial in on the true cause of the problem. And what I want you to do today is I want you to take the answer to this question, and then I want you to keep that top of mind as you go into your objective assessment. Okay, so this question is going to focus you, and then it's going to allow you then to take that information and go into your objective assessment with a new set of lenses, so to speak. Okay, so what is the question? Well, the question is, as you go through the subjective assessment and you clear your red flags and all of that, you're taking your history and what's going on with the patient, I want you to ask this one question. That question is, finish this sentence for me, please. I've never been quite the same since. And I want you to pause. Okay, so I've never quite been the same since, and then pause, let the person think about it, let them process this question, and then let them actually give you an answer. Okay, now again, if their eyes go to the back of their head and they have to actually spend a couple of minutes thinking about this is a really, really good sign. Okay, because it means then they're actually putting the pieces together for you. Okay, so then usually what they're going to give you an answer, it'll usually be something in their previous injuries, or there'll be a time in their life, trauma or something like that. Okay, and then what you want to do then is the answer to that question is going to be gold, because then they're telling you essentially that's when they started to down spiral, okay, in their opinion. Okay, because the patient has the answers. Okay, we just need to get them out of them. So if, for example, I've had quite a few back pain patients. I'm not saying this is with every back pain, where they may have rolled their ankle. Okay, so then as you go into the objective assessment, you're not looking, or you're not biasing yourself, obviously, but you want to be aware of what that ankle is doing and how it's interacting with the rest of the body. Okay, so then you might see somebody, as they go to rotate, the ball of the big toe keeps lifting off the floor. Okay, so in the assessment, then that would tell me, okay, well, they're not loading, or they're not happy to load a perineal still, and that's still not contributing to that movement of rotation, or as they go to touch the toes, or whatever it is. Okay, so again, I don't want to get down into the tactical level here. I want to stay with principles, with frameworks, because that's the ultimate thing that's going to allow you to have the confidence to treat any patient who comes through your door, because you need that structure. Okay, if you have structure and you're not reliant on a handful of assessments or a handful of rehab exercises or hands-on techniques, that's the thing that's going to give you the confidence to help any patient who comes through the door, because now you'll have a structure and a system in order to get the information that you need, and then you can put it together to actually help the patient. Excuse me. Okay, so if you want a little bit extra help, okay, putting the strategy together, we're learning more strategies like this to help you become a confident go-to physio. Okay, then the ProSport step-by-step treatment plan will give you just that. It'll give you the confidence and the certainty to treat any patient who comes through your door. Okay, and how we do that is we do that by keeping the patient progressing all the way through to the final session using that framework. Okay, so that you can ultimately get that recognition that you deserve as the go-to physio. But not only that, it's also going to help you design a step-by-step treatment plan that's going to make a massive difference into your patients' lives. Okay, and again, the higher quality questions, the higher value, the more then we can actually design plans that give real good value. We contribute to their lives in a positive way. Okay, and it's also the most simple and direct way to grow your clinic, grow your career. Okay, if you feel like you should be a little bit further ahead where you are at the moment, we hear that a lot. The ProSport step-by-step treatment plan will help you with that as well. Okay, so if you want to drop me a message. Okay, I've got room for 24 therapists this month. Okay, in this cohort. If you want to, as I said, accelerate your career, if you want to get more done now in the next 3 months than you have done in the last 3 years, then send me a message and let's have a chat. Okay, I hope that helps. Implement that today. I'll see you tomorrow.